Hypersensitivity is actually very common in many of our patients. We're seeing a lot more dental erosion now with a lot of our acidic drinks, acidic foods. So I think it's important that we have several options to help our patients with the increase in hypersensitivity that we are seeing. I've seen primarily sensitivity cases at the CEJ when I'm scaling and root planing at the cervical enamel junction of the tooth. However, with a lot of increased whitening procedures, now we see a considerable amount of sensitivity from whitening, so it can actually include the entire tooth surface. As a clinician, the most important feature for a desensitizer is probably ease of use. However, we should be looking at what is going to give the most benefit for our patients. So we want to make sure that if we are using something, charging them for it, that it is safe and effective, and that it's going to give them the most relief that we can give them. The bioactive desensitizer is appealing for a number of reasons. As a clinician, it's very easy to use. The viscosity of the material itself flows onto the tooth. It doesn't run all over the tooth. And then you simply take the brush, work it into the area on the tooth. But the primary significance of this material is indeed the bioactivity. So the calcium phosphate join to make hydroxyapatite plugs, kind of like when you mix flour and water to make a paste. As you're rubbing onto the surface, the material leaches into the dental tubules to make a plug so that there's no hypersensitivity that runs onto the nerve. It plugs up those tubules very nicely.